Healthcare reform is picking up momentum on Capitol Hill. The Senate Health Committee passed a $600 billion reform plan Wednesday. Now, that's a day after House Democratic leaders put forward their own $1.5 trillion proposal. CBS News senior White House correspondent Bill Plante has more. Good morning, Bill.
Good morning, Harry. You know, all along, the president has said he wants a health care bill written before the August congressional recess. And now he's stepped up his efforts to put pressure on members of Congress. He talked with CBS News medical correspondent Dr. John LaPook.
My main focus is on how we can stop putting money into things that aren't making people healthier.
According to the latest CBS News poll, 62% of all Americans want the U.S. government to exert more control over the U.S. healthcare system. But money, how to pay for reform, is exactly the problem which could doom it. House and Senate Democrats have offered up separate trillion-dollar plans that have no Republican support. Among the ideas on how to pay for reform, charging fees to pharmaceutical companies, a tax on sugary beverages, and a surtax on incomes over $350,000. That's an idea the president supports.
Personally, I think the best way to fund it is for people like myself who've been very lucky to pay a little bit more.
Scornful Republicans say today's economic climate is a bad time to rush through a major spending bill. Now, the debate is far from over, but it looks very much like it will take a lot longer than the president wanted and not result in the bipartisan support that he had hoped for. Democrats have made it very clear that they're more interested in getting a health care bill passed than in getting Republican votes. Harry?
Bill Plante at the White House this morning. Thank you so much. Joining us now to break down the numbers and to explain how health care reform could affect you, Jill Schlesinger, editor-in-chief of CBS News and MoneyWatch.com. Good morning.
Good morning.
So we have a couple of charts we're going to show here. I got the pointer out and everything else. Who does this involve? 97%
of legal Americans will be covered. We have 46 million who are currently uninsured who will be covered. Of almost 160 million people who are insured through their employers may see their premiums go down, and limits on those lifetime caps that people have, those are going to be removed.
Right.
Some of the folks who are paying for their own insurance, they're going to see some benefits, maybe see some breaks.
Right.
And then, of course, we have everyone who's on Medicare and Medicaid continue to be covered.
And this whole notion that you'll be denied insurance because of a pre-existing condition will be done away with. I mean,
exactly.
This is a giant wish list. Okay. So beyond that, then, how does this plan sort of, how does this change? How will we see changes in our everyday lives?
You're going to hear the word mandate. That means you have to buy health insurance. It also means your employer has to have insurance for you.
Which is an evolution in the president, what he said when he was running, when Obama was running for president versus what he says now.
And this is all a negotiation. We don't know. This is the House plan, the Senate plan. Everyone's going to come together. So you got to buy in or you're going to pay a penalty. Your doctor may change. You may find that some doctors don't participate in the public plan, and that could change for you. And as you said, you can't be denied for a pre-existing condition or some health issue that's been in your past.
It's so interesting because there are so many special interest groups who are fighting this and don't want to let it happen. As Bill suggests in his piece, there's popular support for some sorts of change. I think people will start to balk, though, when they see what it may cost. The Senate version over $500 million, the House version more than $1 trillion. Let's talk about how this gets paid for.
Well, this is a funny pie chart because we see tax increase on the wealthy, which is going to pay for half of it. What is wealthy? Well, if you're an individual, it starts at $280,000. For families, $350,000. There's going to be a charge of 1 to up to 5.4% for people who earn over $1 million. So that's going to be the lion's share. Business surcharges. Your business doesn't enroll in a plan, they are going to pay a tax. And that's going to be a problem. Supposedly, Medicare and Medicaid savings. But again, all these numbers are out there. They're up for discussion. We don't have a final plan yet. It looks like there will be some compromise, especially on this little pie chart. I think this is where the special interests are going to come.
And this other one, too, about small businesses and what they pay, because there's the screaming out there, because that's where most of the jobs are generated in the
Exactly. 80% of the nation's jobs are generated by small businesses.
All right, Jill, as always, thank you so much. Jill Schlesinger.